Hey guys, it's Kim. Welcome back to my channel. I have filmed this video about 3 times and didn't realize that I was only allowed to upload for a 15-minute segment at a time. So I need to try to get through this really quickly. I want to do a sort of introduction to the pre and post-op procedures of weight loss surgery. So really quickly, there are 4 types of weight loss surgery. There is the lap band, which is not done anymore because it's got a very high rate of complication. The 2 most well-known and widely done surgeries are the gastric bypass, known as Roux-en-Y or RNY, and the VSG, which is the vertical sleeve gastrectomy or the sleeve. The other kind is called DS, which is duodenal switch, which is a mixture of the sleeve and the bypass. For the sake of this video, we're just going to be talking about weight loss surgery in general and primarily gastric bypass and vertical sleeve gastrectomy. So the difference in those 2 surgeries primarily is that gastric bypass reduces the size of your stomach to about an egg-sized pouch. It also reroutes your intestines. So it bypasses, if you will, a lot of your small intestines, which causes malabsorption, which we'll talk about a little bit later. Keep in mind that the unused portion of your old stomach and your intestines remains inside your body in case there's any issues. That surgery can be completely reversed. With the sleeve, your stomach size is reduced to sort of a banana shape pouch, and nothing is done to the intestines. The unused portion of your stomach is removed, however, so that is a more permanent surgery. Though it can be revised to a bypass, it can never be undone because that portion of your stomach, your old stomach, is removed. That said, I am a very big proponent of gastric bypass surgery. It is the gold standard. There is also a very high rate of complications post-op with the sleeve. And I'm not talking immediately post-op. I'm talking 1 to 5 years down the road. Gastric bypass has a very long history of being a very safe, successful surgery. There are reasons where somebody might have to choose one over the other, and a few reasons would be scar tissue. If there's too much scar tissue, then the sleeve might be a better choice. If you have the need to take NSAIDs, aspirin, Tylenol, Aleve, things like that, then you're probably going to want to go with the sleeve because you can't take them after bypass. However, if you have any kind of acid reflux, you're going to want to go with the bypass. The sleeve is notorious for making acid reflux worse and for causing it in people that didn't have it to begin with. I'm talking about acid reflux so bad that you wake up choking on your own acid and also getting aspiration pneumonia, which you don't want to have. So a lot of people that get the sleeve end up having to have it revised down the road to gastric bypass. So why not just have the bypass to begin with? So with that said, you decide you want to get weight loss surgery. This is what you're going to have to do. In most cases, you're probably going to need a referral from your primary. If not, then start researching surgeons. Find the best one within distance that you're willing to travel. You really want to do your research and make sure that you're finding an amazing surgeon, because that's going to be a huge part of your success. Everybody, depending on their insurance, depending on their surgical program, is going to have different pre-op guidelines or qualifications that need to be met. In the United States specifically, most insurance companies are going to require a 6-month waiting period. Some 3 months, some less, some more, but generally it's about 6 months. During that time, you're going to be asked to follow a specific diet. Again, the diets vary widely from program to program, although most programs are not going to require you to lose any weight on that diet. Some insurance companies will and some surgeons will, but most will not. They recognize if you're there for the surgery, you can't lose weight on your own well to begin with. So you're going to have a lot of testing done. You're going to need to get blood work done. Sometimes, depending on your health history and your surgeon, you might need to see a cardiologist, a pulmonologist. You might have to have a sleep study to determine if you have sleep apnea. Everybody is going to need, hopefully everybody's going to need an endoscopy where they go in with a scope down your throat, look in your stomach and your small intestines. Trust me when I say you're going to want that. You don't want your surgeon going in blind. You want them to be able to know ahead of time if you have a hernia or any kind of ulcers or anything like that. You're also going to require a evaluation by a mental health professional. Okay, you have to have psychological clearance in order to have this surgery. Essentially, what they're looking for is to determine if you have realistic expectations regarding the surgery. They want to know about your support system. They want to know if you're a food addict, which I'd say the majority of the people that have this surgery are. But they want to know if you have a plan in place, tools in place to be able to cope with life without using food to cope anymore. They want to assess your risk level in transfer addiction. So if you are taken away the ability to use food to cope, are you going to transfer that addiction onto something else that's dangerous? They really want to make sure that you're aware of all these risks and that you have a plan in place to combat those issues. That said, some people do fail, but it's usually not forever. Some psychologists will say, you know what, I think you need some therapy before I clear you for surgery. And if they do say that, don't look at it as a bad thing, because I think everybody should be having surgery, should be having therapy before and after this surgery. Anybody that struggles with any kind of food addiction needs to be in some kind of treatment. This surgery is a tool. It is not a quick fix, and unless you fix the root of the issue, you're not going to be successful in the long run. You will lose weight, but you probably will not keep it off if you are not fixing the root of the problem. So a lot of people are talking about liquid diets and 2-week liquid diets. So essentially that's kind of an outdated idea that you need this 2-week liquid diet to get yourself mentally prepped for the surgery. The purpose of the liquid diet primarily is to shrink your liver. It's sort of an added benefit that it gets you psychologically and physically ready for the surgery and to drink liquids after, but it is used to shrink and dry the liver to make it safer for laparoscopic surgery, because they have to use tools to lift your liver up out of the way, and the larger and more slipperier it is, the riskier it is going to be for you to get some sort of liver injury or liver damage. Research has shown that 24 to 72 hours of a liquid diet is sufficient to adequately shrink the liver of somebody who's morbidly obese, regardless of their BMI. So my liquid diet was in fact 3 days. I was not required to lose any weight on my 6-month diet or my liquid diet, but everybody pretty much loses on the liquid diet. I think I lost 9 pounds on mine. So then you're going to have your surgery. I'm not going to go too into detail about that. Usually it's going to be laparoscopic. They will ask you before you go into surgery if something happens. For example, you have too much scar tissue. Do you want us to open you up to do the surgery and do a laparotomy? Yes or no. If you want to have the bypass, if we go in there and there's too much scar tissue, will you consent to having the sleeve? Because sometimes people have too much scar tissue and they just can't perform a gastric bypass and have to end up either choosing the sleeve or nothing. So pain is subjective and everybody's different. I didn't have any pain. The majority of your pain after surgery is going to be from gas. They fill your abdominal cavity with gas to bloat, make everything bigger. Or not bigger, but to make the cavity itself bigger so they have more room to move around. The only thing that's gonna help that pain is walking. Opioids aren't gonna help it. Nothing will help it. That said, a lot of programs will have you on a patient-controlled pain pump, patient-controlled analgesia after surgery. My surgeon doesn't believe in opioids. We got Tylenol. That was all I needed. I was totally fine, had no surgical pain. Post-op, you're typically going to be on liquids for 1 to 2 weeks, sometimes clear, sometimes full liquids, and then you will progress through your diet plan. Again, the diet plans differ very, very widely from surgeon to surgeon. But typically it's 6 to 8 weeks of introducing new phases of foods until you're eventually cleared to a full diet, and you're going to just introduce new things slowly and as tolerated. Meat is one of the last things that you're cleared for because it is one of the hardest things for your body to digest. So after surgery is when you start your vitamin routine. You've got to take vitamins every day for the rest of your life, multivitamins, calcium citrate, B12, and iron. I'm not going to go into more detail about that. I can do a video about vitamins if anybody is curious, but you will also have your labs checked every few months and then every year after your first year post-op to make sure that everything is where it's supposed to be, because again, you're not going to be getting vitamins from your food anymore, regardless of which surgery you have. Sorry guys. Regardless of which surgery you have, you're not going to be able to absorb your vitamins from your food. So you have to take them yourself. Otherwise you will run into massive issues down the road. Your teeth could fall out. You could have organ failure. You will lose your hair, etc., etc., etc. That said, hair loss is going to happen. It's going to happen for most people. There's nothing you can do about it. No amount of biotin or protein is going to help. It will fall out. It will come back. Most people aren't going to go bald. It's really going to depend on how much hair you had to begin with. I had a lot of hair going into surgery, so nobody could tell when I lost hair, and I did lose a lot of hair. But again, it usually stops around the 1 year mark, and it will grow back. The first 6 to 12 months following weight loss surgery are what we call the honeymoon period. Okay, so both surgeries, obviously gastric bypass to a greater extent, but both surgeries cause malabsorption. So for the first 6 to 12 months, you are going to malabsorb your macronutrients. So even if you don't follow your diet and you eat like garbage, you're still going to lose weight because you're not absorbing all the fat and the calories from what you're eating. It's after that honeymoon phase is over that you start reabsorbing your macros, and you could potentially stop losing weight or start putting the weight back on if you're not doing what you're supposed to be doing. And that's where people really run into the issue. The people that go in thinking surgery is a quick fix and they start to see the weight just melt off of them and they're still eating badly, they're like, wow, this is great. I should have done this before. And then once they start absorbing their fat and calories fully again, the weight starts coming back on, and then it's kind of a reality check, a slap in the face, and it can get really out of control really quickly. So that's why I say you have 6 to 12 months to get your shit together and to essentially learn and practice a healthy lifestyle. If you don't, most of us are already aware of what's healthy and what isn't, but we have a hard time sticking to it. This is your chance to do that. It's basically a redo, if you will. You want to take it seriously if you want to be successful. If you want this to work, you basically have to breathe weight loss. Eat it, dream it, sleep it. I don't know. What I'm trying to say is every ounce of your, body needs to be committed to this, or you're not going to be successful. So I guess that's all I'm going to say. I didn't go in nearly as much depth as I wanted to, and this was super rushed because I'm at 13 minutes, and again, I only have 15 minutes, so there's a lot of things that I wanted to talk about that I didn't get to, so maybe I will make another video, and I know at some point I think I get to make videos as long as I want to, but I don't know when that happens. Anyways, guys, let me know what you think. I did make this video for people that are, again, watching Chantel. They're aware that she is going to be possibly pursuing weight loss surgery, and, people want to hear from somebody who's had it what to expect as far as her pre-op and post-op journey. So I just thought that I would give you guys a brief outline of it. Let me know what you think, and I'll talk to you later. Bye.